So you recently just got diagnosed with frozen shoulder and now you want to know all about it. I'm Dr. Wendy. I'm a physical therapist. I've taken care of women for 20 years, and frozen shoulder is something that I talk about on a regular basis. But this article that came out in 2025, let's go through it because this is a nice review in all the current things. It's going to be what you need. And save this, you're going to want it for reference. So by definition, frozen shoulder is inflammation and fibrosis of the glenohumeral joint capsule, and that is your shoulder. There is primary and secondary frozen shoulder. Right now what I am talking about is primary frozen shoulder, which has a more chemical background, versus secondary frozen shoulder, which generally has an orthopedic issue. Frozen shoulder primarily affects individuals 40 to 60 and more prevalent in women. And it is more prevalent in those with conditions such as diabetes or thyroid dysfunctions where there's an underlying chemical issue. The natural course of the disease is characterized in 3 stages: freezing, frozen, thawing, which occur over 2 to 3 years. That is if there is no interventions. Done. Freezing is the beginning, very, very painful. Frozen is the middle, where no change is really happening, but it's not too terrible. Thawing is when it starts to hurt again and you start to gain more motion. Please note that physical therapy is the most helpful in the thawing stage. And in the freezing stage, if you can meet a physical therapist to get an exercise protocol, it's incredibly helpful. At the cellular nerdy level, cytokines are the real jerks of frozen shoulder. Activation of the complex cascade of cytokines, growth factors, and fibroblasts they're too aggressive, result in collagen being laid down in a haphazard matrix of non-invasive treatments such as physical therapy, exercise programs aimed at range of motion and flexibility and strength, along with oral medications such as NSAIDs, to reduce inflammation. Also steroids, oral steroids. Treatment options also include interarticular injections, so injections into the joint, which include steroids to reduce pain and inflammation, but also hyaluronic acid to help with the lubrication and support the tissue. While a variety of non-invasive and invasive treatment options are available, no single approach has emerged as the definitive gold standard. A typical physical therapy regimen includes pain relief modalities such as exercise and manual therapy, mirror therapy, shockwave therapy, laser therapy. Pain relief physical therapy modalities include like ultrasound and E-stem. Specifically, TENS units are helpful to reduce pain, which is by the gate control theory of pain to the brain, which basically the TENS unit isn't really solving the problem, but it's blocking the pain to your brain. And that's okay. Sometimes we need things to help us feel better in the moment. And what exercises would a physical therapist give you? Well, commonly used ones are pendulum exercises, a wall walk or a wall climb, cross-body adduction stretches, and all of these are targeting special motions such as flexion, which is up, abduction, which is going out, and internal rotation, which is going in. These exercises should be performed 3 to 5 times daily, with each stretch held for about 20 to 30 seconds. Strengthening exercises would include isometrics, but they would be pain-free, basically to help the rotator cuff and the scapular stabilizers. And once those are okay, you can progress to a lower resistance exercise, usually using a band. I like to do bicep curls with my patients with using a light weight. Exercises that are done using the rotator cuff muscles or internal external rotation, and it can be such as push-ups, resistance band rows, things that are stabilizing the shoulder and the scapula. And these strengthening exercises are usually performed 3 to 5 times a week with 2 to 3 sets of 10 to 15 reps. Now, why you should go see your primary care doc is oral steroids are very, very helpful in the conservative treatment of frozen shoulder, and they are absolutely proven to provide pain relief when your activities of daily living are severely limited. I don't know about you, but I've never met a person who has frozen shoulder whose activities of daily living aren't limited. And so this is why you must talk to your doctor if you think you have frozen shoulder. Please. These oral corticosteroids are typically prescribed for short periods, 2 to 6 weeks at the lowest effective dose, alongside physical therapy. Yes, please talk to your doctor. Ask for physical therapy. Go to physical therapy. Save yourself. Now, in more aggressive treatment options, they can do an intra-articular shot of steroids or the hyaluronic acid, which acts as a viscoelastic substance that improves joint lubrication, reduces inflammation, and alleviates pain. Think of it as WD-40 of your shoulder. Hyaluronic acid also has anti-inflammatory effects, interacting with the synovial tissues, so within the joint capsule, to reduce pro-inflammatory cytokines. You see, there's a trend. Cytokines. Now, what is unique to this article is a calcitonin nasal spray is an option of treatment for frozen shoulder. calcitonin nasal spray may relieve pain in frozen shoulder by modulating central pain pathways. So nasal spray could be an option. This particular nasal spray is typically administered at a dose of 200 IU once daily for 4 weeks. Common side effects include mild nasal irritation, dryness, congestion, and a rare case of headache or allergic reaction. So in conclusion, in many cases of frozen shoulder, it resolves over time, though the recovery process can be slow, taking years, months. And that's why facilitating the healing process is so important, because yes, it is going to heal on its own, but don't you want to heal faster? Facilitate the process. Please talk to your doctor. Do not suffer, because you're still going to have to treat that underlying symptom anyway. Why suffer with frozen shoulder, the most painful shoulder condition there ever was? Love you, bye.